And joining us now is Ontario's Chief Medical Officer of Health, Dr. Kieran Moore. Good morning, Dr. Moore. Thanks for being here this morning. We just covered a lot of ground right now, but let's talk about COVID case counts at the moment. We understand they're approaching kind of the peak of the summer waves, and the curves and trend lines all seem to be heading kind of in the wrong direction. Despite that, though, demand for boosters doesn't appear to be very high. So are we facing kind of an uphill battle right now?
Well, thank you, Nick. Absolutely see a rise in risk for COVID over the last several weeks in Ontario. Increase in hospitalizations, increase in use of the intensive care unit. Just this morning, I saw 139 individuals in our intensive care units across Ontario as relates to COVID. So COVID's not going away. It's a formidable foe, and we have to maintain that wall of immunity to protect all Ontarians. So I'm very happy that we're announcing the release of the Pfizer bivalent vaccine. So it protects against Omicron as well as the original strain. That's another tool in our kit to protect all Ontarians going into what could be a quite complex and difficult winter.
You talk about the tools in the kit, Dr. Moore. I know masking is one of them, vaccines is the other, but you know, whether it's anecdotally or whether on social media, I'm sort of seeing and hearing from a lot of people who say they don't want to get another shot. So while having vaccines available clearly is good, it's only really effective if people are getting them into their arms. So what else can or will the province do or recommend to sort of try to overcome this?
Well, we're going to be having quite an aggressive communication strategy. We're working with our federal partners, as you've been seeing Dr. Tam on TV, promoting the vaccines. We'll continue to promote the vaccines along with all of our sister health units across Ontario. 750,000 Ontarians still have come forward since September 1st to get their booster dose, which is great, and 30,000 just yesterday came forward to get vaccinated. I'd love to see those numbers higher. We have the vaccine, we have vaccinators, we have capacity for roughly 80,000 individuals a day. So we'll have to continue to communicate this. So thank you for having me on the show. We need to protect Ontarians against this virus as we go indoors. We all have to maintain all those layers of protection, but one of the most fundamental is staying boosted. These vaccines provide a great increase in our immune protection and will decrease our risk at an individual level and community level of getting ill.
And Dr. Moore, switching gears now for a second, let's talk about the wait time data yesterday about the state of healthcare in Ontario. Very lengthy wait times for emergency care, huge delays for ambulance offloads, no public real-time data, basically a laundry list of problems. Is this acceptable from your perspective?
Well, if some of the impact is from vaccine preventable diseases like influenza or COVID, yes, it has a significant import to me because we need to maintain protection against influenza heading into the winter, as well as COVID, as well as pneumonia. So we have vaccines that can prevent individuals from getting ill from all of those viruses and bacteria. We'd love to see Ontarians be maximally protected. So when I say stay up to date, it's stay up to date with all of your vaccines so we can collectively have a minimum impact on our health system. And heading into the winter, we know influenza and COVID and a virus called RSV will have an impact on our health system. Those two, influenza and COVID, we can prevent that impact by staying up to date. And I'm sure all Ontarians want to help our healthcare workers who are working in difficult environments to minimize the impact of those two major viruses on our health system.
And Dr. Moore, some ICU doctors saying that what's happening in hospitals right now feels like deja vu. But let's talk about children's hospitals that are beyond capacity. Parents cannot get pain medications for their kids. What is your plan, the province's plan, to fix this?
Well, number one is staying up to date with the immunizations, because many of the illnesses that are making children go to the hospital are preventable through vaccination, whether it's pneumonia or influenza and or COVID. So that is an important step we can all take, and all of our public health colleagues are working collectively to try to ensure children are protected as well. If we see a significant impact on the health system, we will be making more and more recommendations of wearing masks to cut down the risk of all these viruses that are transmitted through close personal contact as we go indoors. So we're monitoring that data very closely. We're monitoring the impact on the health system, and we will make recommendations based on data to inform Ontarians of when we have to mask up more. Certainly, if you're at risk to this virus at present, we need you to mask as you go indoors. If you are immune suppressed or elderly, as we go indoors, and now that we're seeing a rise in cases and impact on the health system, we should be masking as we go indoors.
A two-part question here, Doctor, just picking up on what you just said about the sort of potentially talking about masking. Are there going to be publicly released metrics so we understand when that may be, when masking, whatever you're alluding to there, may be coming back? But you also, in your previous answer, discussed the difficulties for healthcare workers that they're facing right now. We understand, of course, ICU numbers seem to be okay right now, but in ERs, pediatric medicines, that they're managing incredible volumes of patients, nurses working flat out, managers doing what they can to sort of, improve the flow. So is there a specific plan to support hospitals and healthcare workers and patients, of course, through the fall and winter months?
Yeah, so from the public health perspective, we're monitoring on a daily basis the impact of all of the major viruses, whether it's RSV, influenza, and or COVID. And we know what works in Ontario. We know vaccines work. We know that the basic tenets of staying home when you're ill, good cough etiquette, hand hygiene, plus masking, all are effective, because the last 2 years we haven't had any significant impact from influenza, for example. So we're monitoring those metrics of the influence of those viruses on the hospital system. And from a public health perspective, we'll certainly make recommendations if the collective admissions from all of those viruses are going up and having an impact. That's preventable. So we will make recommendations to the public to mask up as we get further along. But certainly at present, as we're seeing the numbers just in the last 2 weeks go up, my recommendation would be anyone at risk to this virus, continue to mask as you're going indoors in at-risk public settings.
All right. Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, appreciate your time this morning. Thank you.
Thanks, Dr. Moore.
Thank you.